The Gleason score in a pathology report indicates the aggressiveness of prostate cancer. A Gleason score is determined by adding the two most prevalent grades of cancer cells observed in a biopsy. In Gleason scoring, the first number represents the primary, most dominant cancer grade. The second number in the Gleason score indicates the secondary, second most dominant cancer grade. Therefore, 3+4 and 4+3 represent different cancer compositions and prognoses, despite summing to the same total. Prostate cancer cells are examined under a microscope to determine their characteristics. The Gleason score is a system used to grade the appearance of prostate cancer cells. Grading involves assessing the size, shape, and arrangement of the cells. The Gleason score provides information about the aggressiveness and prognosis of the cancer. The Gleason score assigns two numbers to each tumor based on its cell patterns. These numbers represent the primary and secondary grades of the tumor. The Gleason score helps determine the aggressiveness and prognosis of prostate cancer. The first number represents the most dominant cell pattern observed in the tumor. The second number represents the next most prevalent cell pattern. The sum of these two numbers provides the final Gleason score. The first number in a scoring system typically represents the most frequently observed pattern. The second number in the scoring system indicates the second most common pattern observed. This two-number system provides a concise summary of pattern distribution. The frequency of patterns is determined through systematic observation and data collection. These patterns are ranked based on their prevalence within the observed dataset. This scoring method allows for efficient communication and analysis of complex data. The Gleason score is calculated by adding the two most prevalent grades of cancer cells observed in a sample. The primary grade represents the most common pattern of cancer cells. The secondary grade represents the second most common pattern of cancer cells. The sum of the primary and secondary grades results in the total Gleason score. Gleason scores range from 6 to 10, indicating the aggressiveness of the cancer. Higher Gleason scores indicate a more aggressive form of cancer. The Gleason score is a grading system used to determine the aggressiveness of prostate cancer. A Gleason score of 3+4 indicates that the majority of the cancer cells exhibit a pattern grade of 3. The 3 in 3+4 represents a moderately differentiated cancer cell structure. The +4 signifies that a smaller portion of the cancer cells display a more aggressive pattern grade of 4. The Gleason score is derived by adding the two most prevalent grades of cancer cells observed in the sample. This score helps determine treatment options and predict the prognosis of prostate cancer. The mathematical expressions 3+4 and 4+3 both result in the numerical answer 7. However, in a clinical context, these expressions can represent different sequences of events or treatment protocols. The order of interventions can significantly impact patient outcomes and treatment efficacy. Clinical decisions must consider the specific implications of each sequence, even if the numerical sum is identical. Therefore, while mathematically equivalent, the clinical interpretation of 3+4 and 4+3 can differ substantially. Gleason score 3+4/7 indicates a predominantly Gleason pattern 3 with a lesser component of Gleason pattern 4. Gleason pattern 3 signifies a less aggressive cancer cell type compared to Gleason pattern 4. The Gleason score reflects the combined aggressiveness of the two most prevalent cancer cell patterns. In Gleason 3+4/7, the dominant pattern 3 influences the overall behavior of the tumor, but the presence of pattern 4 increases its potential aggressiveness. Gleason 4+3/7 indicates a predominantly pattern 4 component, signifying a more aggressive disease characteristic. The 4 in Gleason 4+3 denotes that the majority of the tumor sample exhibits the characteristics of pattern 4. The +3 signifies the presence of a secondary, less prevalent pattern 3 component within the tumor. The overall Gleason score of 7 reflects the combined aggressiveness indicated by the dominant pattern 4 and the contributing pattern 3. The expression 3+4 can be visualized as a sports team composed of 3 rookie players and 4 veteran players. Conversely, 4+3 can be visualized as a sports team composed of 4 veteran players and 3 rookie players. Although the composition of veterans and rookies differs, both teams have the same total number of players. This analogy demonstrates that changing the order of addends does not affect the sum. A Gleason score of 3+4 indicates a favorable intermediate risk. This Gleason score suggests a moderate likelihood of cancer progression. Treatment strategies for Gleason 3+4 cancers typically involve active surveillance or targeted therapies. Regular monitoring and follow-up are essential for managing Gleason 3+4 prostate cancer. Gleason score 4+3 indicates an unfavorable intermediate risk. An unfavorable intermediate risk suggests a faster rate of disease progression. The Gleason score is a key factor in determining treatment strategies. Regular monitoring is crucial for patients with a Gleason score of 4+3. Understanding the Gleason score helps patients make informed decisions about their care. Gleason 3+4 prostate cancer may be eligible for active surveillance. Active surveillance involves monitoring the cancer without immediate treatment. Regular checkups are essential in active surveillance to track cancer progression. Active surveillance aims to delay or avoid aggressive treatments unless necessary. Active surveillance is a management strategy, not a curative treatment. Gleason score 4+3 typically necessitates active treatment interventions. Active treatment options may include surgical removal of the affected tissue. Radiation therapy is another common active treatment approach. Active treatment aims to manage and mitigate the progression of the condition. The decision for active treatment is based on a comprehensive medical evaluation. Research from Harvard Health indicates a correlation between Gleason score and recurrence risk. Mayo Clinic studies corroborate the increased recurrence risk associated with specific Gleason score patterns. Patients with a Gleason score of 4+3 face almost double the recurrence risk compared to those with a score of 3+4. Gleason scores are a key factor in assessing the aggressiveness of prostate cancer. Understanding Gleason scores is crucial for informed treatment decisions and patient management. Gleason score 7 prostate cancers exhibit heterogeneity. Gleason 7 tumors can be composed of different combinations of Gleason patterns 3 and 4. The varying proportions of Gleason patterns within a Gleason 7 tumor impact its aggressiveness. Therefore, not all Gleason 7 prostate cancers are biologically equivalent. Although 3+4 and 4+3 both result in 7, the order of addition can represent different processes or contexts. The commutative property of addition demonstrates that the sum remains constant regardless of the order of the addends. In some real-world scenarios, the order of operations affects the practical outcome, even if the numerical result is the same. Understanding the nuances of mathematical operations is crucial for accurate modeling and problem solving. The expression 3+4 can be analogized to a mild storm in terms of intensity. Conversely, the expression 4+3 is analogous to a hurricane, representing a higher magnitude. This analogy illustrates that, while the numerical result is the same, the perceived impact or intensity can differ. The weather analogy helps to understand the concept of varying intensity or magnitude despite identical outcomes. In Gleason math, the first number in an equation is considered the boss. The goal is to have the less aggressive boss in charge to simplify the calculation process. Choosing a smaller number as the boss can make the math problem easier to solve. This approach simplifies complex problems by strategically reordering the equation. Cell patterns exhibit distinct structural and organizational differences. Microscopic analysis reveals variations in cell, shape, size, and intercellular spacing. The arrangement of cells within each pattern contributes to their unique overall appearance. Comparative visualization aids in distinguishing between cell pattern types. A risk spectrum visually represents the range of potential risks from low to high. Gleason scores are used to assess the aggressiveness of prostate cancer. Gleason 3+4 indicates a moderately aggressive form of prostate cancer. Gleason 4+3 indicates a more aggressive form of prostate cancer than Gleason 3+4. Active surveillance is a treatment option involving regular monitoring without immediate intervention. Surgery involves the physical removal of cancerous tissue. Radiation therapy uses high-energy rays to kill cancer cells. Treatment options are selected based on the Gleason score, which indicates the aggressiveness of the cancer. Higher Gleason scores often correspond to more aggressive treatment options, such as surgery or radiation. Recurrence rates in Gleason scores provide critical prognostic information for patient management. Gleason 4+3 exhibits a significantly higher recurrence rate compared to Gleason 3+4. This difference in recurrence risk necessitates tailored treatment strategies. Accurate Gleason scoring is essential for informed clinical decision-making. Active surveillance involves regular monitoring to detect changes in a condition. Regular follow-up appointments are essential for tracking the progression or regression of the condition. The watch-and-wait approach is implemented through consistent surveillance. Active surveillance aims to avoid immediate intervention while closely monitoring for necessary action. This video provides clear explanations of men's health reports. Subscribing ensures access to more informative men's health videos. The channel offers no-nonsense explanations of complex health topics. Stay informed and take control of your health by subscribing.